Your body keeps working even when you sleep. However, it is not just resting. It might be quietly breaking down muscle overnight. That sounds scary, but it is also a chance to help your body. Can sleep really drain muscle strength? Here is the simple truth. Sleep is a fast. No food is coming in for many hours. In younger bodies, muscle building can still keep pace. In older bodies, it often falls behind. Muscle mass can drop 1 to 2% each year after 50. By our 70s, about 1 in 5 people have sarcopenia. By our 80s, it can be half. Sarcopenia means age-related loss of muscle and strength. It raises fall risk, pain, and fatigue. I'm Drew Mercer. After my dad's fall, fear stole his confidence. I teamed up with a geriatric physical therapist and a cardiology nurse. We tested safe routines and simple nutrition in clinics. We watched seniors stand taller and steadier. Safety first before we start. This is education, not medical advice. Talk with your doctor, especially if you have kidney or liver problems. Take blood thinners, have diabetes, or manage bone disease. If swallowing pills is hard, I will give food first options too. Have you or a loved one noticed strength fading with age? To see why nights matter so much, let's define sarcopenia and then fix the nighttime gap. Many people think muscle loss is just normal aging. However, it is not that simple. It is a medical syndrome called sarcopenia, and it is more common than most of us realize. So what is sarcopenia and why should we care? The plain definition is this: it is a progressive loss of muscle mass and muscle strength. That loss raises the risk of disability, poor quality of life, and even death. After age 50, most of us lose about 1 to 2% of muscle each year. Strength often falls a little faster. When strength drops, balance and walking suffer. Falls, fractures, and fear can follow. In our clinic, we use simple screens like grip strength and chair stands. They are quick tests, but they tell a big story. Lower scores link with higher fall risk and slower recovery after illness. I have seen the relief on a client's face when chair stands get easier. Confidence returns step by step. Here is the key link to sleep. Night is a long stretch without food. If muscles don't get what they need before bed, small losses can add up over years. If sarcopenia is so common, could nightly fasting make it worse? Let's look at what happens while we sleep. Sleep might feel refreshing, however, the body is still busy. Overnight is a long fast. No fuel comes in for 8 to 12 hours. Without food, your body looks for energy. In older adults, it may tap into muscle protein more than we want. Does the body really use muscle during sleep as we age? In part, yes. Younger muscle responds strongly to earlier meals. Older muscle is less sensitive. This is called anabolic resistance. It means we need more protein and key amino acids to get the same muscle-building signal. Here is the kicker. About 40% of adults over 70 do not even reach the basic protein minimum of 0.8 grams per kilogram per day. If dinner is tiny and breakfast is late, muscles go a long time without building blocks. Small nightly losses can snowball. I see this in real life. Many seniors tell me dinner is a snack and then nothing until late morning. Energy dips, steps feel heavy. The good news is we can tip the scale back. Could targeted nutrition at bedtime slow that breakdown? Yes. We will count down 7 helpers you can use tonight. Number 7 is a pair of vitamins that defend your muscle cells.
Number 7 will not shock you, but it matters. Vitamin C and vitamin E can help protect aging muscles. Think of them as armor against wear and tear. Can they slow muscle loss? Not by magic. They support the system that repairs you. Vitamin C helps build collagen, which is the scaffolding for tendons and muscle tissue. It also helps wounds heal. Vitamin E protects cell membranes from damage by free radicals. As we age, oxidative stress rises. Reviews of nutrition for sarcopenia consistently include vitamins C and E among the studied options. The theme is simple. Deficiency makes recovery harder. Adequate intake clears the way for better repair. Here is how to try it safely. Aim to get vitamin C from foods like oranges, berries, or bell peppers. A modest supplement can fill gaps if needed. For vitamin E, nuts and seeds are great. If you use a supplement, avoid mega doses. If you take blood thinners, ask your doctor before adding vitamin E. Bedtime tip. Take vitamin E with a small fat-containing snack. Take vitamin C with water, or include it in that snack. Have you taken antioxidant vitamins before? Up next, number 6 is a mineral that helps muscles relax so you can rest and rebuild. In number 6, we have magnesium and a few mineral friends. Magnesium is the quiet workhorse for muscle and nerve health. It helps with energy use, muscle contraction, and muscle relaxation. Why highlight it at night? Low magnesium is common in older adults. Diets often lack leafy greens, beans, and nuts. Low levels can mean cramps, twitching, and restless sleep. That is a rough setup for recovery. Many of my clients sleep better and wake less stiff when they add a gentle form like magnesium glycinate in the evening. Here is a safe plan. Try 200 to 300 milligrams about an hour before bed. Start low if you are sensitive. Glycinate and citrate absorb well, with fewer bathroom surprises. If you have kidney disease, heart rhythm issues, or take certain antibiotics or thyroid medicine, check with your clinician and separate magnesium by at least 2 hours. A little potassium and zinc from food can also help, like a banana and yogurt with dinner. At bedtime, think calm muscles, calm nerves, steady sleep. That is how repair happens. Ready to build on that base? Number 5 is the sunshine vitamin that speaks directly to muscle fibers and balance. Number 5 is vitamin D, often called the sunshine vitamin. It does more than protect bones. It also supports muscle fibers and the nerves that tell them when to fire. How does it help? Vitamin D helps your body handle calcium. That supports contraction. Muscles also have vitamin D receptors. Low blood levels show up often in adults over 60. Less time outside, thinner skin, and gut changes all play a role. When levels are low, weakness and poor balance are more common. Many experts recommend testing and correcting low levels to support strength and fall prevention. The smartest move is to ask your clinician for a simple blood test. Here is a bedtime plan. If your level is low, a common daily dose is 800 to 2,000 units of vitamin D3. Take it with dinner or a bedtime snack that has some fat. That improves absorption. If you use calcium, do not overdo it, and spread doses through the day. If you have high calcium, kidney stones, sarcoidosis, or take certain medications like steroids, ask your doctor before starting. With bones and muscles on better speaking terms, let's step to number 4, a muscle energy booster with decades of research behind it. In number 4, we have creatine. You may hear Jim talk about it, but it is not just for athletes. Creatine helps muscles recycle energy quickly. That can support strength, power for daily tasks, and recovery. Does it work for older adults? Yes. Studies show that creatine with simple resistance training leads to greater gains in strength and lean mass than training alone. It also may help during rehab after illness. The most studied form is creatine monohydrate. Here is a safe, simple routine. Take 3 to 5 grams once daily. Evening or bedtime is fine. Consistency matters more than timing. Mix it in water, milk, or your protein shake. If you have kidney disease, are on diuretics, or have a history of swelling, talk with your clinician first. Drink enough fluids. A small carb source like half a banana may help uptake, but it is optional. If this is helpful, subscribe for calm, evidence-based tips from Age Strong. It lets more seniors find safe guidance. Creatine gives us a sturdier energy system. Now let's add the fats that quietly protect muscle and, yes, can even nudge muscle building in older adults. Number 3 is fish oil. In number 3, we have omega-3 fatty acids from fish oil. Most people know them for heart health. Here is the pleasant surprise. They can help muscles too. How do they work? Omega-3s, especially EPA and DHA, reduce chronic inflammation. That matters because inflammation can speed muscle breakdown. Research in older adults also shows a direct anabolic effect. In plain words, omega-3s can help your body build and hold onto lean mass and strength. Some studies link higher omega-3 status with better grip and walking speed. Your bedtime plan is simple. Aim for 1 to 3 grams of combined EPA and DHA per day. Take it with dinner or a small snack that has fat, like yogurt or a few nuts. That improves absorption and reduces fishy burps. If you take a blood thinner, have a bleeding disorder, or have a fish or shellfish allergy, talk with your clinician first. A freezer-kept capsule can also cut down on burps. We now have antioxidants, minerals, vitamin D, creatine, and omega-3s in place. But taking pills is not enough. How you time and pair them matters. Let's unlock the absorption secrets next. Taking supplements is not enough. When and how you take them can change what your body actually uses. Here is an easy bedtime playbook to boost absorption. First, fat carries fat-soluble vitamins. Take vitamin D and vitamin E with a snack that has fat. A few nuts, cheese, or olive oil on crackers works. Second, give minerals some space. Magnesium and calcium can compete. Take magnesium at night and save larger calcium doses for breakfast or lunch. Keep magnesium 2 hours away from thyroid pills or some antibiotics. Third, creatine is flexible. Mix it with water, milk, or your shake. Hydrate well. Fourth, fish oil is happier with food. Dinner or a bedtime snack lowers reflux. Now the power move for muscle. Add a slow protein at night. Casein from milk digests over hours. It feeds muscles through the night. If dairy bothers you, use lactose-free milk or a low-lactose yogurt. You can also use a casein powder. Before we tally the list, plan a routine you can keep. Dinner with fat for vitamin D and fish oil. A little later, magnesium. Before bed, protein plus creatine if you like. Ready to see the biggest nighttime builders? Number 2 is your bedtime protein. Number 2 is casein, a slow-digesting milk protein. This one has strong evidence for nighttime use. In a clinical trial with older adults, drinking a large casein shake before sleep raised overnight muscle building by about 1/3 compared to having no protein. The protein was digested during sleep and delivered steady amino acids. That is exactly what we want at night. Why a big serving? Older muscles need more to get the same signal. 40 grams before bed worked best in that study. 20 grams was not enough unless they added extra leucine. So what does that look like at home? A casein powder shake is the simplest route. Mix it with milk or lactose-free milk. You can also make a thick Greek yogurt bowl and stir in dry milk powder to raise protein. Add cinnamon or berries for taste. Safety first. If you have kidney disease or your clinician has limited your protein, do not try this without medical guidance. If dairy upsets your stomach, go lactose-free or use a casein isolate. Sip slowly so reflux stays quiet. Casein feeds the night. Now for number 1, the amino acid trigger that flips muscle building on. At number 1, we have leucine and essential amino acids. Leucine is the on switch for muscle building. It activates a pathway called mTOR. Older muscle is stubborn. It needs a stronger push to respond. Here is what the research tells us. A bedtime protein with enough leucine raises the building signal. In that overnight study, 40 grams of casein boosted muscle protein synthesis by roughly 1/3. When they gave only 20 grams of casein, it underperformed. But adding about 1.5 grams of extra leucine to that smaller dose brought results close to the bigger shake. Some headlines claim a 45% overnight boost. The truth is closer to 30 to 33% in that setting. Still, that is a powerful win. Your simple target is around 2.5 to 3 grams of leucine at night. You can hit that with 30 grams of a high leucine protein like whey, or with an essential amino acid powder that lists leucine on the label. If you have a rare metabolic disorder or strict protein limits, get medical advice first. Will you add a leucine-rich snack to your evening? Time to wrap everything up and choose your first step. Here is the big picture. Sleep is a recovery window, not just downtime. If we feed the body right, we can slow nightly muscle loss and wake up steadier over time. Your 7 bedtime helpers, from 7 to 1. Vitamin C and E for cell protection. Magnesium and minerals to relax and restore. Vitamin D to support nerves, fibers, and balance. Creatine for fast muscle energy. Omega-3 fats to calm inflammation and support lean mass. Casein protein to drip-feed amino acids through the night. Leucine and essential amino acids to trigger the growth switch. Pick one change to start this week. Maybe add fish oil with dinner. Maybe mix a casein shake an hour before bed. I made you a printable checklist with doses and timing. Grab the link below and review it with your doctor. This channel is educational only. I am not your clinician. If you have kidney or liver disease, take blood thinners, manage diabetes, or have protein limits, talk with your care team first. If you found this helpful, subscribe and share it with a friend who wants to stay strong with Age Strong. Thank you for watching. What one change will you try first to support your muscles? I am rooting for you. Stay consistent, stay curious, and stay strong.